I think one of the most important issues that we've heard from the beginning is the lack of supplies in the First Nations, and the inventory in their local stores was depleted for all the things that were needed for people to protect themselves. So that we started advocating to different corporations that work in our First Nations to ensure that the inventory was restocked, and that was also like a problem because of the delay in the transportation of supplies. But we've been advocating very strongly to our partners in the communities and to ensure that the First Nations have the food and the supplies they need. And that's an ongoing discussion we're having. And also one of the things that also we've been advocating for very strongly is the funding needed for each First Nation. We've been advocating that the First Nations receive some funding for people to be able to buy supplies for their homes, and that these things are in the works, and things are going to happen and unfold. And I know that people become very frustrated in their First Nations, but we're doing our part to support the chiefs and their councils in their community. Every time there's an issue, we mobilize right away to ensure that the advocacy is there to the governments, be it federal or provincial. And also there's a lot of issues that we have to deal with as far as transportation is concerned. I know there's a lot of people that want their borders secured and make sure that the in and out transition of people is to a minimum, if not totally preventing people. Some people have chosen to do that, but I think that those are areas of concern that people have had. The funding, are they going to have access to funding to be able to support their communities, to support their families? And we're making sure that we're on the phone with the federal government every day, and also to First Nations Inuit Health Branch to make sure that the nursing stations and also the testing sites that have been talked about, we're advocating that there will be more testing sites in First Nations or near First Nations, because our people need to have testing sites, and also advocating that we have the capacity to set up testing sites away from the nursing stations, because that's not a place where you want to go to get tested, because especially if people are ill. So they're trying to think of ways to try to plan ahead, so in the event that it hits one of our First Nations, we have to be ready to mobilize in the quarantine efforts, and also to be able to isolate people from each other if they have been infected. And I know that we don't wish that upon everybody, but the reality of the matter is that things will happen, but we're trying our best to make sure that our people know what to do when this happens. So we're advocating every day for everything from the winter roads, that the people need to have their access to their roads to be able to bring in supplies, much needed supplies. And also First Nations have reached out to us to advocate that the roads will be accessible for a few more days to be able to do business, and also to be able to get important supplies into their communities. So those are the things we're advocating for.